and welcome back to the Pawsit podcast. I'm Dr. Sam with Dr. Robert, as always.
Welcome back, everyone.
And we're really excited because we have installment number 2 about our toxicities. And this one's a really good one. And it's kind of a bit of a broad topic because we try to do things that grow.
Yeah, things that grow.
Things that grow. Um, so that means some plants that are really common. And then just some things that grow as well that are newly something that people
Newly
have
popular
access
for the
to.
last decade.
Exactly. So kind of the things we'll cover today are first things like lilies. That's a really common one. It's a common toxicity. It's a big one for cats if you have a cat.
Totally.
Um, grapes. Grapes are a big one for dogs more so. I don't think I've ever heard of a cat eating a grape.
Yeah, mainly dogs. A little
Dogs.
bit controversy with that one, obviously, but it's
Yeah. Well, yeah, and I'm just actually learning that there's a controversy with that one because I didn't actually know that was controversial. So I'm gonna learn something too along with everybody else. And then a big one, marijuana.
one of the most
The
popular ones by
One of the
far.
most popular toxicities that we have. So we'll get into that a little bit. And then we have some honorable mentions at the end of just some little things that I know I get called about here and there. And I'm sure that Robert probably does too, because you probably
Yeah,
get more toxicity phone calls than anything else, would be
just
my
weird
guess.
things you guys are letting your dogs eat. I tell you, it's just
Seriously. Well, to be fair, just to make everybody feel better in the listening world, Gus threw up a sock 2 days ago.
see,
So
vets are people too.
yeah, exactly. I try as hard as I can. I have a lab and he will eat anything that you put in front of him, food or not. And I have 3 children, so as much as I tell them to pick up their socks, it is their favorite thing to do is to kick off those socks and leave at least one somewhere where he can get to it. And so
Yep.
um and now everybody probably knows the difference between vomit and regurg because we talked about that in a previous podcast.
Hopefully, you're paying attention.
Well, there you go. I heard the abdominal component. It woke us up from our sleep and we promptly got him outside, although the sock came up first.
That's good, at least. That's good. So
Yeah.
it's
I do have to give Gus credit though. He always manages to vomit up the socks that he eats. This is not the
that's good.
first, nor will it be the last, I am sure. I'm waiting for the day that I'm gonna have to go in surgically and remove some crazy thing from his stomach, but wasn't this
Yeah,
time.
that's right. I feel like he passed most things. He's a big enough dog, but sometimes
You
I don't know.
he always vomits them up. I mean, knock on wood, because I'd rather he vomited them up than,
Oh yeah, every time.
exactly. But yeah, I don't know.
It was just funny because how many owners come in, they're like, "Oh, my dog ate a sock," and then they puke the dog. There's like 4 socks that come up. They're like, "Where did all those come from?" I'm like,
Right,
it
right.
happens all the time.
Oh
So,
yeah. Oh yeah, we'll definitely have to have a lightning round of the craziest thing you've ever gotten up from a
oh
dog,
god,
because
yeah, that'd be a fun one time because
yeah,
yeah,
there's some
that's
good
definitely.
ones.
Oh, I
There's
can.
some really sometimes it's amazing that people aren't embarrassed by what comes up because
Oh, I'd be horrified at some of the cases that.
me too.
Yeah, I'd be like,
I've
"No,
got a
that's not
couple of good
mine."
ones.
So,
Well, getting right to it then.
mhm.
Lilies. So I think it's a good thing to know about. I would say this is actually one that most cat owners are kind of aware of. I don't think that this is too much of a shock to anybody, right?
Ah, I think it's because people don't know what the plant is and they don't
Hmm.
figure it out. Most toxicities I see is like they got it as a gift and they don't like most people aren't botanists. And they're like, oh yeah, I got a bunch of flowers, and it's like a nice gift from their significant other. And all of a sudden they find out like a day and a half later their cat got in like, oh, it's a lily. And they're like, crap, I have a cat. And then that's the
I guess
problem usually.
that does make a lot of sense. I have had some people call about peace lilies, which are not
Oh,
actually lilies. I'm pretty
gotcha.
sure
See,
that's the one. Maybe I'm thinking about
I
the
think you're
wrong
right.
one.
Yeah, I honestly
Yeah,
because
because I look it up every time. See, this is what we are saying. This is one of those ones when it comes to plants, when it comes to anything that grows in the ground other than maybe marijuana, because I
yeah,
already know what to do with that. Um, I I always look it up because just in case I don't know plants well enough just
mhm.
inherently. And then I also have the two guys I work with, thank God, know lots of plants. I'm like,
Hey
if this
man,
is a lily, I
they're
don't
great
even know.
resources, man. I'd use them all the
Yeah.
time.
Yeah. No, it is really nice. And they're usually like, oh no, that one's not toxic, or yeah, this is toxic, or so but maybe talk a little bit about what you see, the progression of what happens when you see a cat that's gotten into lilies.
Yeah, a lot of times they'll just notice it like they didn't realize they got a gift, and they'll say like the pollen, and the big thing is like any part of the lily's toxic. Doesn't matter what part they eat, like it's
Mm-hmm.
leaves, pollen, anything. It's all toxic cats, and it's very, very toxic. If you don't find out about it soon enough, it usually means your cat's going to go into some level of kidney failure. Just imagine like how severe it is. If you're, I'll say generally, if you get on board quickly and like you realize, and making them vomit is not really realistic. Honestly, it's so hard to do. I
Yeah.
think we talked about this previously,
Yeah.
but if you get on board soon enough, like get them into the hospital soon enough, we start them on fluids. Usually, they do pretty well.
Yeah. And when you say fluids, Robert's talking about,
Oh,
this is a
thanks.
hospital stay. This is IV catheter.
Hmm.
We are actually giving them IVs, like if you're in the hospital,
Yep.
very much just like that, catheter right into the vein. Um, and then we're going to try to diurese them. So give them fluids intravenously.
Hmm.
Um, how many days do you think that you find that they have to stay with you?
We keep them for 2 if their values are normal, because we'll repeat their blood work and urine for 2 days straight.
Mm-hmm.
If it's all normal by the 48-hour mark, we're like, all right, you can go home, just come back at the 72-hour mark and repeat blood work.
Okay.
If there's any changes at all in their kidney values, though, they stay for 3.
3. Yeah. I would have thought that seems about reasonable. I mean, just
Mhm.
based on acute kidney injury in general, right?
Yeah. And
So,
then, yeah, I
yeah.
think dialysis is the only thing we consider in the extreme cases. Like usually it's like a day after they got into it, or really just really proactive owners.
Yeah.
But that's usually like heavy known toxicities.
Sure. And that's also a pretty, like, that's not something that I've actually ever experienced being where I am.
Mm.
I don't have any place around here. Maybe Purdue is probably the
Purdue,
closest. And that's,
probably Purdue, I would say. Yeah.
yeah, that's a vet school about 2.5 hours south of where I am in northern Indiana.
Mm.
And probably the closest place where you could go get dialysis. But I don't know that most people would actually know what that is, maybe. So maybe you could explain just like really briefly what that is.
Yeah. And essentially what we're doing is we're taking your cat's blood and filtering it out through a machine to remove the toxins. Yeah, essentially, that's what we're doing in a nutshell. So that way, when they do ingest the lily and that toxicity, we're able to remove it from the system so it doesn't cause damage to their kidneys. Um, and sorry, particularly in Lily's case, actually, it's more like we're taking away the toxins, because when your kidneys aren't working well, those toxins build up. So in this case, we're actually removing the toxin from your system, or the kidney values are increasing more so than the actual lily toxin itself.
So not to say that like you can remove the toxicity that you're basically taking
Yeah.
like what happens to the body naturally when you have damage to the kidneys. That
Yes.
is where toxicities build up in the system because they can't come out the normal way because your kidneys aren't functioning properly. And so
Yeah.
now Robert is going in and fixing it,
Yes. So we
which
pretty
is
much we
really interesting because that's not, I mean, it's not a common thing, I would say, around here, but for you, this happens pretty often.
Yeah, because we're one of 2 areas in probably Southern California that do it. I went to like LA, and so we get a lot of referrals from like places that do that. And we see it for a lot of things like drug toxicities, and that way actually we are moving the toxicity, the actual toxin from the blood instead of the result of them. So like that one we're actually binding the toxin and getting it out of there. Whereas like lilies, we're just more focused on the after effect. So what the kidneys are not able to do, then we're actually filtering their blood for them and removing those kidney value toxicities.
How long does that take? How long is a general dialysis?
Honestly, it depends on how many times they get done. It's just really expensive. That's the biggest thing too. Like, I think for a couple treatments, it's like $20,000. Like, it is not a cheap thing to do. Insurance is great if that's the case.
Will
Um,
insurance actually cover that?
yeah, it's considered an emergency. I guess it depends on your insurance, but as long as you have insurance that covers emergencies, yeah, it'd be considered an emergency, and you get it done that way. But yeah, if you're gonna
And
do
so people
nothing,
are still having to pay what, like 10% of it though, right?
yeah. So, but yeah, I'll pay 2 grand over 20.
Oh my gosh. I
So
mean, that's not even,
yeah.
yeah, that's a totally different story.
Yeah,
That puts it within a reach of a lot of people who otherwise would not be able to do it. And I'd still
mhm.
say there's still a good handful of people that probably couldn't even do
Yeah,
that.
exactly. It's not super common. Like I said, we just happen to work with UC Davis, so we're blessed in that regard. They're very smart people over there, and they do a lot of the work. I just get them the animals when they need to have treatment. So they're
Yeah.
wonderful people.
I mean, it's a fascinating thing. It's nice to see that because those are things that are a bit more commonplace in like human medicine, but
Mhm.
because of the way that veterinary medicine is, just people pay out of pocket for things. And so
Yeah.
there's not as much in the way of like having insurance and stuff like that. So few people have insurance for their pets.
Mhm.
Which is probably something we should talk about at some point in time. So stay tuned because we'll definitely talk about
Yeah.
insurance.
Insurance definitely one of the big ones in the future. We'll definitely
Yeah.
cover that one because it's such an important part of our growing industry, I would say.
All right. Well, and a big part of like why we even, started my Balto is to try to give people back their money, try to make things just a bit more within reach. I don't know. Hopefully one day we make things like dialysis more in reach too. But
I
the
know, right?
point is to try to be able to do what's best for your pet without worrying about the cost and letting that be too much of an issue. But that it has to be. I mean, it's part of the conversation.
Oh yeah, and I think the exciting part is that one day when more and more people have insurance and doctors get to practice the medicine they want to practice, the field starts to excel even further in terms of medicine because we see more information. And probably some people don't know is a lot of times veterinarians, a lot of things have a hard time getting proven because there's so few patients we have going through it.
Right.
Like when you have case studies of 10,000 people, we have like maybe a case study of like 12 dogs that we're
Right.
going off of evidence. So like it's really tough for us to find out if something actually works because we have 12 patients compared to literally hundreds of thousands in
Right.
human medicine. So it's so much harder for us to prove something works until you have research grants, stuff like that. So the more people that can do those things, then we start seeing the evidence of why things work and can build off of that, which is really the exciting thing, hopefully in the next 10 years.
Yeah, yeah. I mean, I think the more that we can do to make we treat our pets like family, but then we really get put in these just really horrible situations if you
Mhm.
don't have tons and tons of money and it you shouldn't only be able to have a pet if you have tons and tons of money. You know what I'm saying? Like
Yeah.
obviously we should hopefully as a group of people who love animals enough that we've dedicated our lives to it that we should all be able to kind of work together to make things more within reach, but at the same time everything costs money. We can't
Yeah.
we can't have these hospitals and have the ability to do these things if people don't pay for them. So there's a
Yeah.
it's a real hard thing. So hopefully more and more people will get insurance, and that will be something that is just going to let medicine take off a little bit more in veterinary medicine.
Definitely. And that's something
Yeah.
hopefully my Balto will help out with long term, but that's a
Let's hope so. So everybody
long
needs to
time
check
away.
out my Balto.
Yeah, exactly.
Not
Something
to
down
be
the
too much
line.
of a
Uh,
PSA, but then getting on to another thing that can really affect the kidneys. I guess we'll go right into grapes, which is
mhm.
kind of, I mean, I don't really worry too much. Dogs don't really eat lilies and they're not toxic to dogs.
No.
So, but grapes, however, are
Yep.
toxic to dogs. And so I guess I've always operated under the understanding, and every time I look it up, I don't really ever seem to see anything else that we don't actually know the amount that's toxic.
Yeah, we don't even know what is toxic about them.
Right.
That's why it's tough. Like we don't know if it's a red grape, green grapes, seedless. Like we just don't know.
Right.
And I think that's what's challenging about it because like when they come in, they ask like, "Oh, what type of grapes they eat?" Like, it doesn't really matter because we
Oh
just don't know
no.
if it's
Yeah.
toxic. What makes it toxic?
But then it's true, like people like used to use raisins as training
Hmm.
for dogs. So I
Oh, I got
mean,
surgeons that
obviously
still do
there's
that.
what?
I got surgeons that used to give their dogs grapes all the time. They knew better. It's like that's a grape. Like that's how like some people are about it these days.
Yeah. Oh wow. So I guess that to me is a little bit different. Like I feel like usually somebody tells me their dog ate a grape, I'm like, well, just vomit them. I mean, I don't see the point in even taking the chance. So I
Yes,
guess
I
I'm
agree.
curious what your thought is.
Yeah, that's honestly the conversation I have with most people. I'm like, just honestly, at this point, it doesn't do you any good to keep it in there, and unless they're like a high risk breed for aspirating, so like your Frenchies, English bulldogs, or dogs that have like laryngeal disease, something wrong with their throat and their ability to swallow. Otherwise, yeah, I'll just make them vomit most times and just check blood work once a day for the next 3 days. But I don't hospitalize them. I don't, and that used to be the gold standard. Like they got into grapes, you hospitalize them for 48 hours on fluids and
So treat them like someone that got into lilies.
yeah, exactly. Like that used to be kind of more the gold standard, and now it's just kind of excessive. I think
Yeah.
because I see it so rarely.
And I will actually say more and more that is what I'm seeing as far as like
Mm,
when one of my patients got into grapes, like they'll vomit them, they might like
mm,
check their blood work like initially to have a baseline and then say come back and check. Now they don't say come every day for 3 days, but they'll say like go
gotcha.
back and set in like 48 to 72 hours and check to see where they're
Yeah,
going, and then So I mean that's usually what I've seen, and then I'll tell people, yeah, I mean we should recheck. And
Mhm.
I've actually never seen a dog go into kidney failure from a grape. I've not seen it.
I've seen three. One was actually a week ago. Around, and that one was it was mild. They only had one grape, but it had it's kidney. When we say, I guess, when like vets talk about kidney injury, just for like the greater public, even if there's two values we look at, there's a BU and the creatinine. If any of those values go up while they're on fluids or while they're away, that's concern for an acute kidney injury. So
Right.
like this injury wasn't severe, but the values went up for this the one a week ago. But it was weird because I was like, I don't know what to do because like, do I ignore it because only a little bit, or do I come back, bring them back in? Like it was just you see it so rarely nowadays.
Right. Well, what did you do?
The dog was acting fine at home, and we just had to recheck blood work in a week. And we should have had healthy water amounts at home, but otherwise, yeah, that one it was a very small increase, but it was like went from like 1.2 to 1.7, I think, like that. So it was like, oh, we're keeping an eye on this, but the dog was doing fine at home, still eating, drinking, and yeah, those things changed, and we would have brought it in.
Well, right. And I think too, it's always important for people to understand, like, just because we see something that's elevated or we see something that's changing that could indicate an issue, blood work is a snapshot in time. It is telling
Yep.
us what's happening this moment in time, this day. And most things can be influenced by more than one other thing. So
Oh yeah.
sometimes hydration status can make a difference in what we're seeing in a kidney enzyme. So it might have nothing to do with the fact that he ate a grape, but
Yeah.
maybe he's just a little bit dehydrated or something like that. And now you're
Mhm.
seeing changes, right? I mean, like, I guess the,
Exactly.
the point is that not, we always run the risk of like, I always want to tell people, I'm like, when I get blood work back, I'm always be like, okay, this could be, you know what I mean? Like, I'm always like, I'm not
Yeah.
worried, but like, let me just share with you what I'm seeing, and then we'll decide what we need to do something about. Because, like, it's hard. And then there are some people that want to go through every value, like, well, why is
Mhm.
this? Because the blood work, when it comes back, at least for
Oh,
us,
it's
it's like
so
red
annoying.
or it's blue
Yes.
when it's not in the
Oh,
normal range. And it's like, okay, I get that it's red, but like,
it's like a
that
little
doesn't
red.
mean anything. And
It's
it's
like
also like the top end of this range is here, and it's like a blip over that. That doesn't mean anything.
it's because you feel bad. It's hard to explain that to owners sometimes because like for
Yeah,
potassium, when your potassium's 1 point higher, that's more of a concern than like your sodium. Your
right,
sodium being like 1 point high means nothing.
right.
Your potassium 2 points high is like this is a concern. Like it's just
Yes, we have a
so it's just
problem.
funny.
Yeah,
Yeah, exactly. And that's why is hopefully I trust your vet and they'll bring up the values that aren't important because otherwise we'd be there talking all day. And sometimes I'm like just ignore half of the sheet. The only thing that matters is these two because
yeah. No, I do the exact same thing. And but then every once in a while, you get people that just they want to understand. I mean, it comes from a very good place, but they're like, "Well, what does
yes,
this mean?" And you're like, "Nothing. I
it's
don't
like
even know why
literally
it's
nothing.
there. It means nothing."
It is
Like,
another
or
value.
you're like, unless this is different, this doesn't matter. Like the fact that
Yes.
this is like this doesn't matter. Don't worry, just
Mhm.
ignore
It's just
it.
it's you see nothing.
Yeah, but it can be really difficult. And like the thing is, sometimes you do see a change and you're like, I really can't explain it. I don't know why
Mhm.
it happened. I don't know what was going on in the body at that moment in time, but we checked
Yep.
it in a week and it's normal.
Yep. CK is one of those
Yay.
examples. Yeah,
Yeah.
CK all the time goes up. I'm like, I have no
I don't
good
know.
reason for why this went up. So I'm sorry.
Yeah. I'm so sorry. And it
Yeah.
doesn't matter because it's not like a thousand-fold above the like, you know what I mean?
Reference range.
Yeah,
Exactly.
exactly. So sometimes that's the other thing too, is that, like, certain things are very tightly controlled in the body, and it's like, if that goes out of whack, ooh, that's a problem.
Mhm.
And it looks like it's not a problem because it's like just barely high. But then like some things you're like, oh no, no, that has to be like way higher before I'm gonna
Yes.
even worry about
Yeah, I don't pay attention
that.
to it till it's like
Yeah.
threefold higher.
It's
So
like orders of magnitude higher before I even care. So that can be really tricky. But I like to explain things to people. I sometimes explain it too much, I guess, but that's
that's better. I mean, it's better than yeah,
you
it's
know,
actually probably better that way.
I'm the right vet for some people, and I'm not the right for some other people. That's okay. That's okay. I try my best.
I think that goes true for all of us. I think sometimes I make some owners very happy, and other ones are like, I need more explanation. I'm like, this is all I
Yeah.
have time for, so this is what we're doing.
Yeah. You're
No,
like, so we're gonna move on.
yeah, it's like it's not a big deal.
Me, they're
Um,
like, you've been in that room for an hour. You need to come out and see your other patients.
oh God, it's some
But that's
families are
okay.
very they care a lot. That's the important thing. They care a lot.
Well, you know what it is? I'm just a mom, you know what I mean? So I want to
Mm.
like I'm just like, okay, let me explain this. So anyway.
That's a good thing.
But so that's grapes.
Mhm.
So I guess call your vet that you trust, that you have a great relationship with because you see them at least once a year. And if you don't do that,
Mhm.
you should do that. And then but yeah, if your dog ate a grape, yeah, call your vet. Apparently
At
it's
least
not
make
so
them
cut and
vomit.
dry, but I would say get it out unless they have a higher risk of vomiting.
I would agree. Yeah, pretty much a general rule of thumb. At least make them vomit. After
Yeah.
that, you can have a discussion, but at least get them to vomit because it's better safe than sorry in most cases.
Yeah, and so that's actually an interesting thing. Making them vomit at home. What's your feeling on
Um,
that?
unless it's something that's you
It's a
can't get to
hard
the
one.
hospital,
Yeah,
unless you
it's
can't
a
get to
hard
the
one.
hospital in time to like effectively induce vomiting. I would say most times bring them in and don't do it at home because I think I briefly touched on this beforehand, but like people
Yep.
try and use hydrogen peroxide and it's been shown to cause esophagitis or just inflammation of the esophagus, which can cause more problems later, actually. So it's like, yeah, if you can bring them in, I know it sucks. First of all, it sucks expensive. I get it. Um,
But it
but
can be so much more expensive
yes,
if you end up causing problems because of it. Now, I will say that I have worked with veterinarians that feel totally comfortable being
mm,
like, here you go, hydrogen peroxide all day. They'd use it on their own dogs. I can tell you that I would not. I would
yeah,
go into the clinic and I would do it in a controlled setting because the other thing too is that what if they did aspirate or what if, you know what I mean? Like,
mhm.
especially if you have a smushy faced dog,
And
I
that
would
has
not
happened.
advise that.
Like I've seen it happen where a dog is aspirated because we need to get something up because it was extremely toxic,
Yep.
and they aspirated on the spot, and then they arrested afterwards. We got them back because it happened right in front of us, but that probably wouldn't have happened
At home.
if they were home.
And that's
So
like not to be scaring people, but that's like a worst case
yes,
scenario. That
sorry,
doesn't
yes.
happen. Most of the time people give and it's fine. And they actually don't even get the esophageal issue, which is the
Yes,
esophagus getting
exactly.
inflamed.
It doesn't happen all the time, but it
Nope.
does occasionally. And it's like,
But I had one where I pretty much will never recommend that ever. Like I'll say you have to come vomit them. But
yeah,
I had we'll talk about rodenticide in another podcast, but I
mhm,
did have one that was the really bad rodenticide and she could not bring her dog or refused to bring her dog.
yeah. And that's the thing, but we're going to
You
work
know what I
with you the
mean?
best way we can. But
Yeah.
like,
So
I've seen distance be an
ultimately
issue. Yeah.
that had to come up. That I
Yeah.
mean, there's just that can't stay.
Yeah.
So in the end, but that dog did get esophagitis
Yeah.
and ended up
That's,
going to the emergency clinic anyway.
yep.
So
So it's,
so when we're telling you to come in, it's not because we want your money. I promise you, it's because we want
God.
what's best for your dog.
Yeah. Honestly, we're so busy right now. I'd rather you stay home in most cases and just
If
not do it in the
yeah,
first
if it's
place.
something that I don't have, like I love to see people and we have like great relationships with our patients and stuff like that. So like I truly do. There's so many people that I'm really really lucky to have great relationships with,
Mm.
but I will never tell you to come in because I just want money
No, actually, I would
ever.
purposely tell you not
That will
to
never.
because
If I can do anything to keep you from having to have the stress and the expense,
mm,
Robert's right. We have tons and tons and tons of patients that need to be seen every day.
yeah, honestly, that's a huge thing. And
Hmm.
something maybe just from the veterinary side of things that we don't like writing records. It's something we didn't sign up to do. Like we know it's part of the job, but like
Yeah.
it's probably every vet's least favorite part of veterinary medicine
Yeah.
because you have to keep accurate medical records. And
Yeah.
every time you come in and we have a conversation and I charge you for it, I gotta write a record now, regardless of
Yeah.
how thorough it is. I gotta write a record,
Right.
and I don't want to write that record for something that doesn't need my time or you to
Right.
be there. So really,
Right.
I'll keep the money, stay
Yeah.
home in those
It's
cases.
fine. Yeah. Yeah. Right. Exactly. Oh, it's true. I was actually having that conversation today. I was like, if I didn't have to write a record after every single interaction, I was like, this would just be the greatest thing
It'd
in
be
the
literally the
world.
greatest job in the world. But
Yeah,
because I have to
it
write
really
records, I hate
is.
them.
That is the one part of our job that I'm like, I don't like writing records either.
Absolutely hate
Takes
it.
so much time
Absolutely.
too.
Oh
Yeah.
yeah, absolutely hate it.
But moving on to my
Yes,
all-time favorite toxicity of all
that's good to
toxicities,
know.
that would be marijuana.
Yes. Yeah, which is interesting because we work on different sides of the country and we have different perspectives, I think, of what clients we see and how that works. Um,
100%. I
yep.
will say, so I am in the Midwest. I'm in Indiana. So it is still illegal in Indiana, but it is legal in Michigan. And where I work is right on the border. So ever since it became legal, people are much more comfortable telling me that that's what it is. But I would say for the first, you know, 6 years or 5 or 6 years, people would just be like, I don't know. They couldn't know. I have no idea. And I'm like, I'm not going to call the police. I don't care. Can you just tell me? Because we're done here. If that's what it is, great.
Yeah.
Otherwise, we have to do a lot of work to figure it
So
out.
much easier. I got always my favorite those like when there'd be a kid in the room and the kid wouldn't say a damn word. And you could
Yeah.
tell like you're the guilty one here, but I can't call you out in front of your parents.
Uh-huh.
So or the drug
Yeah.
test would come back positive and it'd be like, who wants to explain this oneself?
Right, exactly. It's like, well, somewhere, maybe on a walk,
Who knows?
somehow there was THC somewhere.
Yep.
But honestly, the reason why we're making light of this is because it's fine. They'll sleep it off. They'll be
Yes.
okay. There really is, I would say, rarely any medical intervention needed.
Most time, the only things I'll do for them is just give them fluids and the anti-nausea medication because like they'll come
Serenia.
from yeah,
Yeah,
Serenia. It's
it's
the best drug
magic.
in the world.
It's true. It really does help them. For whatever reason, I've also I've heard from multiple people it like actually helps. I haven't had one since I heard this,
Mhm.
but that it kind of just like helps them to not be as high as fast for whatever
Oh,
reason.
really?
I don't know if that's actually true, if you've seen that to be true.
It wouldn't
Um,
shock me with Serenia, man. That drug, like, I'm not trying to
because
be a spokesperson for Zoetis, but
right, it's
Jesus,
amazing.
it's amazing.
It's really like it's like in what's that movie like where like the dad sprays Windex on everything like
Oh, the Greek, my big fat
yeah
Greek
my
wedding.
bigger
It's a
I'm like
great movie.
that's Serenia. I mean
That's
that
exactly the veterinarian
literally does
Windex
everything. And then
fixes it. It fixes it
fixes
most
it.
of the
It's
time.
great.
It's a great
Yeah.
drug.
Yeah.
That's so
It really
funny.
is. I guess we should explain what that is. It is a very potent anti-nausea medication
Mm-hmm.
that has some anti-inflammatories and anti-pain side effects. Is that a
Oh, it's
good
yeah. It came out. I can't remember how many
explanation
years
of what
ago, but it's
Serenia is?
the
It's
best drug in the
amazing.
world.
It works really, really
Yeah.
well, and it works for 24 hours, and it's a brilliant drug. I will
Mm-hmm.
say.
Yeah.
And but yeah, for our pot dogs, they just are high.
Yeah, it's so funny because
It
owner,
really is
you feel
really
bad.
funny.
It's not funny, but owners are coming freaking out. Like there's like
Because it
my
can
dog
look
is
really, really
satiating. It's
dramatic.
horrible.
Yeah. I mean, yeah, sometimes they're like peeing themselves. Like
Oh
they're
yeah.
just so out of it. I saw a pug one time when we were still in school
Mhm.
that I mean, I remember the resident comes back and she's just cracking up. She's like, this is the highest dog I've ever seen. And he was just like loving life. Like he was not sad, he was not miserable. He was just like feeling it. Like he should have been at the
Just
Grateful Dead concert. Like he
he's
was so
vibing out.
happy. Yeah. And we make light of it because it really is like of all the things that it could be,
Mhm.
they're gonna be fine.
Yes.
And I don't have to worry about them. And so when we have things like that, because our adrenaline starts to go up too, we hear like there's a toxicity, there's a dog coming in, it's like,
Mm.
and then you're like, oh, it's
They're just high.
they're just high.
Yeah, I'll say there's only one case, and this is because the guy who brought the dog in was like 100-pound lab. It's the guy who sold edibles.
Mm,
And the dog
Edibles
got
are a little
into
more like they're just harder to predict,
and
right?
they're
I
more
mean,
potent, like most of the time they're more potent too. And the dog got into like 30 gummies, which is
a
like a
lot.
month's supply apparently for some people of marijuana. The dog, we actually had to intubate the dog and keep it overnight because it was like it couldn't actually swallow or really wasn't breathing well on
Oh,
its own. So like that was the one time that was a little more serious. But outside of that,
yeah. Or
um,
if the edibles are really fattening, like if it's chocolate brownies, but then it's a chocolate toxicity. It's
yeah,
not a pot
different story.
toxicity.
They
But
kind of
that
balance
was
each other
last
out though.
podcast. Yeah.
They kind of
Right.
balance each other out though. I've seen dogs like they don't like they eat a ton of chocolate, but they don't have the high heart rates because the marijuana keeps it down. It's like it's actually kind of work out pretty well in that case sometimes. So
So
I'm
are you
like,
saying that when we have a chocolate toxicity? No, I'm just kidding.
here you
Don't do
go.
that. Don't do that.
Yeah, please
We're
don't do
not,
that.
we're not saying to do that at
Oh
all.
God, that'd be the worst.
I know, right? I heard it on a podcast.
It's like, yeah,
Set your
those
dog
two
high.
doctors. Yeah, it's like,
No,
yeah,
no, definitely don't do that.
yeah.
Don't add to the problem.
Mm,
But no, ultimately I think we make light of it when it's something that's like, okay, this is gonna be
mhm,
just fine and they're gonna be
yes.
okay. So just rest assured, don't have to lie to us. We're not gonna call the cops on you
Don't lie.
ever. I've never met a veterinarian that ever wants to turn anybody in. All we want to do is make sure your dog is okay.
Mhm.
I've never heard of a cat having a marijuana toxicity.
No, unfortunately not.
Yeah, I
Not on
was
my
gonna say
end.
I don't cats don't really, I mean, for the most part, they don't really eat too many things that are
They're the
that
smarter pet by far.
yeah. They have
this, I
other
think.
issues we can get into another day, but that is
Yes.
not one of them, thank
That is
goodness.
not, yeah, thank God that's not one of the issues.
But I think we could do probably some honorable mentions of some things. So what are some other things that people call you about?
Other things. Most of the time it's stuff. I'm trying to think. Well, medications we'll get into next time.
Yeah,
Um,
we'll talk medications on the next one because that's a pretty long list. But I'm talking
yeah,
about things that grow. So just keeping in our same
things that
thing.
grow.
So I know like Christmas is coming up, so poinsettias is a big one. People always ask about
Yeah,
that. That's more of an irritant, I think. I don't actually know that it gets very far. Isn't that
yeah. And actually,
true?
most people are pretty smart about that one. I actually haven't seen a point to that toxicity in such a long time.
Yeah,
It doesn't come up as
that
often.
one.
And it's seasonal, obviously, too. So that's probably part of the reason in San Diego, not really big on the whole poinsettia thing. I don't know.
Which is interesting because it's actually like a tropical plant, I think.
Really?
Yeah,
Yeah,
which is
yeah, I
weird,
guess so.
but it's a
Maybe
Christmas
people
plant,
are
and I don't really
keep
know
away from
why.
their.
But
Yeah, I don't know.
it
They keep
won't
away
stay
from
out.
cats.
You can't put it outside. Like it won't. At least I don't think you
Hmm.
can. I don't know. I don't know a lot about plants, obviously. I'll move on.
Yeah.
So, mushrooms, well, in the Midwest, like we do get a lot in our backyard. But apparently where I am right now, like they're not toxic. The ones that so people call all the time, like my
That's
dog
good.
ate a mushroom. They're not toxic, which I learned from the doctors I work with. So very
Mm.
thankful for them. And
Yep.
then and you said you've never seen a mushroom toxicity, right?
Yeah, not the actual like natural ones.
Well, those are natural too.
Yeah,
They're just a
that's
very
right.
specific
Those are
kind.
natural too, but they're grown with a purpose. So those I've seen a
Yeah,
fair amount
how
of.
does that go when a dog
Oh
gets into
man,
magic mushrooms? I've never seen that.
most times they do pretty well, but they are like I thought high dogs were high. These guys are on just different level, man. They're just those ones I feel bad for because they're just
Yeah, because they can't
so
come out of they can't like
no.
that's not enjoyable in
It's
any way.
totally different for
No.
somebody that just take it so much harder. So
Well, you
yeah,
ever
avoid
think
that.
like you feel bad for dogs when you can't explain what's happening to them anyway? Like you really can't
Mm,
explain that to them.
yeah, it's a yeah that one's rough. So
Yeah.
avoid that
What
if
do
you
you do?
can.
Do you sedate them?
Mostly, yeah, like a lot of times we'll consider like ace promazine to like keep
Yeah,
them calm, just because it's a nice sedative type drug, and yeah, just let them ride it out. But it's
ride
you
it
just feel
out.
bad.
Yeah,
Um,
that's a rough one. That
mhm,
seems hard to me.
yeah,
And then I guess there's a few things like when I lived in California, so when I lived in LA, there was oleander just like growing in the backyard. That's one,
yeah,
like a flower
this
that you have to be careful of.
yeah, and like sago palms. That's probably one of the big ones out here in California right now. They're like little seeds that dogs can eat, and they're problem for two reasons. One is they call liver failure, and two, they get obstructions because of them. So it's like kind of
Double
a double
whammy.
whammy in some dogs.
Yeah.
So those are probably the big ones that are most common
Yeah.
out here right now.
Foxglove, I think, depending on where you live, that's
Mhm.
digitalis. It's a heart medication.
Yeah.
It's based off of that. So I guess I would say if you move into a new house and things
Mhm.
are blooming, maybe like Google the different pictures, you can figure out
Yeah.
what they are. And you can always ask your veterinarian. I'm sure they'll look it up for you, but there are lists of toxic plants too that you can look up.
Mhm.
Um, and I would say if people give you flowers and you have an animal that eats things or a cat, just make sure it doesn't have lilies in it. And any of these other, toxic plants, I guess always just check that they're pet friendly.
Mhm. No, I agree.
Um,
Yeah, and if like worse comes worse, call your vet or just don't trust what you see online. There's
oh
everything.
yeah,
Every
always
plant will,
verify. Always
yeah,
verify.
every plant will say it's toxic to some component because it'll cause like even just GI upset, which is considered toxic. But doesn't mean there's going to be long-term issues. Just means it just might be going to cause them to vomit afterwards. So
Right.
be careful what you read.
Oh
Just
yeah,
call a vet.
even like the question about like grass. I mean, some
Hmm.
dogs just like to eat grass. It's not, it can be a GI
Mm.
irritant,
Yeah,
it can make them throw up. But there's a lot of bad information about that too. Like it's just some dogs just really like to eat grass. Like doesn't mean they're
yeah,
sick and it doesn't mean they're missing anything in their diet. It just like just like grass.
yeah. So it's
That's it.
just
It's like pretty normal behavior actually.
mm, totally.
Super common. So I would just say, I guess if you're going to plant stuff in your backyard, check with your veterinarian first that it's not something that's toxic. If you're going
Mm,
to use mulch, make sure it's not the cocoa mulch because that's
yeah.
chocolate.
Well, either way,
Yeah.
call your vet or
Yeah. Call your
ASPCA,
vet.
poison control, or someone just before you start taking any action on your own, because
Yeah.
otherwise mistakes happen.
Absolutely. Absolutely. And that's what your vet's there for. And they'll guide you if they don't know or they can't look it up, they'll guide you to a place that they can. I'm sure most are pretty good about giving that information out. So
Yeah.
but as the questions do come up, you can always ask us questions and we're happy to answer them. We can't give
Mm,
out specific veterinary advice, but we can answer general questions. So why don't you give the
So you
email?
can email all those wonderful questions to podcast@mybalto.com. And we'll do our best to either address them in the next episode or make it its own episode if it's a big enough topic.
Absolutely. All right. Well, this has been the Pawsit podcast. As always, I'm Dr. Sam. This is Dr. Robert. And all right, we'll finish. Oh, we've got 2 more toxicity podcasts coming
Mm.
up. So our next one, like Dr. Robert teased, we have medicine. So that's going to be things that are commonly in the house. And there's a
Mm.
lot of those. So stay tuned for that. And then after that, we did want to get into kind of rat poison, rodenticides, I should say, and
Yeah.
have a quick discussion about xylitol at that point. So
Yeah.
come
That'd
back
be a
and
good
join
one.
us.
Cool. Thanks, guys.